Was it to come to this at the end? I never knew it will reach this stage. Those will be the obvious questions you'll be asking yourself after finding yourself in a mess that you could have helped yourself out earlier in advance through our videos or through our online education. Why did I ignore? That will be among the questions. So guys, welcome back to our online education. And before we start our today's topic, I always appreciate your support. I appreciate those who are liking, commenting, and those who are subscribing. Let's continue sharing and going through our videos. And if it were not for you, this channel could not be where it is today. So let's subscribe, let's like and comment, and let these videos help us in our today's life, so that later on you won't regret and say, I wish I went through these videos. You have the time now, and the time is today. Today we'll be talking about what we call an ear infection. This may sometimes be called otitis media. So, an ear infection, sometimes called acute otitis media, is an infection of the middle ear. It's an infection of the middle ear, the hair-filled space behind the eardrum. I want you to get this very clearly. Otitis media, or infection of the ear, is an infection of the middle ear, the air-filled space behind the eardrum that contains the tiny vibrating bones of the ear. And children are more likely to get infection than adults. I hope you get that point. So, this is a very common condition in our today's life. Each one of us have ever seen or experienced this kind of a disease, whereby you will see some fluid coming out of the ear. So, what are the symptoms of an ear infection or otitis media? So, onset of signs and symptoms of ear infection is usually rapid. And signs and symptoms common in children include the following. Number one, ear pain. Obvious, where there is an infection, there is ear pain. And if there is a discharge, which might be fluid or pus, means there is a wound or an ulcer in the ear, and it must be painful, especially when lying down. Number two, we have what we call tugging or pulling at the ear. You will see the child pulling the ear like this because of the pain. Number three, we have trouble in sleeping. This infection might bring about fever, sleeplessness, and it will make the child have trouble in sleeping. Number four, we have what we call crying more than usual. The child will cry more than usual because it brings irritability and pain and sleeplessness. We have what we call fastness. Number six, we have trouble hearing or responding. We usually come across so many parents having been beaten their child senseless, thinking that the child is ignoring the mother or the father. only to realize when they come to us that the ear has been blocked due to an ear infection. So if your child is not responding when you talk to him or her, instead of beating him or her up, take the child to a medical practitioner to see where the problem might be, because maybe the child is not ignoring you but might be having a ear infection. Next point, we have loss of balance. Sometimes you might find one ear is hearing, the other one is blocked. So the child will tend to change the position of the head so that he or she might get the sound clearly, and this leads to loss of balance. We have fever, which in most cases is always high grade fever. Obviously, where there is an infection, no doubt there must be fever. Next point, we have drainage of fluid. Drainage of fluid from the ear. Drainage of fluid from the ear, which might be pus or it might be clear and smelly. Obviously, we must have headache. And next point, because this is an infection, there must be loss of appetite. So those are the common signs to children. So what are the signs in adults? Because this infection can affect both adults and children. It's not meant for the children alone. So how will an adult present when having this disease? Number one, there will be ear pain. Number two, there will be drainage of fluid from the ear. And also there will be trouble in hearing. To greater extent, the adult might start losing balance. Obviously, there must be headache. And also trouble in hearing and responding, like in the case of young children. So, when should you visit your healthcare provider, or when should you call your doctor when you have an ear infection or otitis media? So here, signs and symptoms of ear infection can indicate several conditions in a person or a patient. So it's important to get accurate diagnosis and prompt treatment. And this can only be got when you visit your healthcare provider, because he will be in a position to make a clear diagnosis whether it's otitis media or a ear infection or another condition. So call or see your doctor if, number one, symptoms last more than a day. The symptoms run more or last more than a day. This infection can sometimes clear by itself within a day. So if the symptoms persist more than a day, see your doctor or call your healthcare provider. Number two, when symptoms are present in a child less than 6 months of age. These are very young children, a very young child. So when those symptoms are in such a child, you should see your healthcare provider or your doctor. Another point, you should be call or see your doctor when the ear pain becomes severe, or when the ear pain becomes severe. Number four, see your doctor or call your healthcare provider when your infant or toddler is sleeplessness or irritable after a cold or other upper respiratory tract infection. See or call your doctor when you observe, this is another point, when you observe a discharge of fluid like pus or bloody fluid from the ear. Also, see your doctor when you realize that your child is having high grade fever, which might sometimes make the child have convulsions or seizures. This marks the end of our first video today. We are still on the same condition, and guys, let's meet in the next video. And thank you for your time. Thank you for the far you have taken me. Let's meet in the next video.